air cleaners. But what we also saw is it reduced illness. So we saw that you could still have outbreaks, even if you have HEPA filters in your classroom, but the underlying illness absence in those schools was about over 20% better, reduced, when we've got the air cleaners in place. So they do make a difference to illness. But to be successful, they need the right design, right considerations, and the right engagement to make them work. What about the cost? Everybody's going to think we always have to think about the cost. And yet it's cost effective. There's data from many studies, and this is an example from the UK Royal Academy of Engineering, research on infection resilient environments, just considering if we improve ventilation in buildings, will that reduce what is it cost effective from an infection control perspective, a respiratory illness perspective. And what you see is that public buildings, community buildings, it is effective. The cost benefit is there. It's greater than, in this case, a cost benefit ratio of 1.5. For many commercial buildings, it's also the case. It's harder to make the case in domestic environments, but it's the public buildings where we ought to really be investing, and we can show that that can be cost effective. These are short-term things we can do, but long-term, we need this systemic change. We need to make a step change and a long-term improvement. That means we need to be thinking about the data to make sure we can evidence the risks we have, evidence the impacts of interventions. We need to collaborate, both within our disciplines, across our disciplines, and between all of our nations. We need to connect things up. We can't look at indoor air alone. We can't look at climate alone. We have to put the two together. We have to put it together with all of our other policies as well. We have to keep innovating, but innovating responsibly, making sure that those products and technologies are not causing harm, are not a waste of money, that they are the right things to do. I think there's a massive change we can think around standards, but even with the standards we have, we don't enforce them effectively, and there's a huge amount we can change there. We also need to think about retrofitting there. Most of our buildings for the next 50 years already exist. And then education. We need education right from primary school all the way through. We've embedded the concept of recycling and sustainability with primary school. Why are we not embedding the concept of healthy buildings right the way through the system? So I'd like to thank you, and I'll pass over to the next speaker.